And as long as I can remember myself, I think in my childhood, I remember being interested in medicine, first in teaching, but then I realized it's not, I don't know how I realized being a child that it's not something that I would want to pursue, but I was interested in medicine for sure. I always liked watching films with doctors, doing the treatment of patients. So even throughout the school, that's something that I was interested in. Biology, chemistry, I loved it. And so I decided to pursue medicine. During my studies in medical university,
in Lviv?
In Lviv, yes. I realized that surgery is something that I have passion for, because there is this combination of using your brain but also your hands to resolve the problem. So I've been praying for it. During my medical school, I became very serious about my relationship with God and my faith. And so I realized there are a lot of challenges being a surgeon, and then also a female surgeon, even more so. So I was praying about it and pursuing it, and applied for surgical residency or internship in Ukraine. And I was able to get it up north in Chernihiv region, which was a big move for me because I've always lived in Lviv. Surgery is not only knowledge-based, but also skill-based profession, medical profession. So you have to commit yourself into developing the skills. So working with patients, practicing surgery, working with surgeons, being in the operating room. I think faith grew me into a doctor I am right now, and I'm still growing, but so, Jesus, he taught us that we have to love one another. And surgery and medicine overall, any serving profession, I think, is a profession that has a high risk of burnout and compassion fatigue, emotional distance from a patient. But patients do need your care, not just as a doctor, but as a human being. Sometimes you are tired, sometimes you need space from patients, sometimes you would want to give them more, but you just don't have much. And so that I feel like God gives grace, and shows that he loves me and he cares for me. He gives me time to rest so that I can also go and give my best to my patients. And being a doctor, I felt like I had the passion to serve in underserved areas, to help with my skills to cover the needs of those who are in need, in a big need, and where there is not many doctors. And Africa seemed unbelievable and unrealistic, but it was something that I was interested in, the continent I was interested in. And during my residency, working with those mobile medical Christian clinics, I met a lot of missionaries who came both to Ukraine, but they've served in Asia, in Africa, in South America. And when I lived in Ghana, I realized that other cultures think differently, but they are still people. They still have their opinion. They still have their choices, destinies, things that happen. So I feel like that experience also helped me learn how to love people better, even if they have a different worldview. If they understand some things differently than I do. I went to Guatemala, Jordan, and Eastern Ukraine back in 2015. That was my first missions with mobile medical clinics into the zone of anti-terroristic operation. And then in 2023, 2024, I went to Guatemala and Jordan for short-term medical trips. This time, a couple months ago, I went to our first aid stabilization station. I got an opportunity to go there because of the course that we performed for military surgeons back in May. and we stayed in touch with some of the participants. So the group I was with, medical group I was with, they go for 3, 4, 5 days to be in that stabilization center station, and then they go back to the safer environment to rest, recuperate, while being substituted by the other unit. The commander, medical commander I was with, he has a great attitude of training his team and building up his team in, you know, trust and support. So it showed me a lot of how people can choose, you know, how to use the situation for good, you know, building up team spirit, building up support, building up trust, helping his team to develop the skills. On the stabilization station, when we had injured, you know, I was helping with stabilizing them, taking care of wounds, removing shrapnels, and sending them to the next level of help. I also do some surgical procedures here for veterans. Mostly it's shrapnel wounds, or not wounds, but the pieces of explosives that ended up in their body, you know, if I need to remove it, if there are indications for it. Like I had a veteran who needed MRI and he wasn't able to get it up until all the metal pieces are removed from his body, right? And so I had to operate on him twice, because first time we found on X-ray that he has some remaining shrapnels in his leg and neck and arm, and then later on we found more in his forearm. So here in safer environment, I take care of those cases more than. Soon after the medical Ukrainian Catholic University Medical Clinic opened up, I was looking for a job. You know, my specialty right now is more pediatric surgery. I do both surgery and pediatric surgery, but I specialize in pediatric surgery and ultrasound. And so they were looking for a pediatric surgeon, and I was looking for a job, and I really wanted to have a job where the team share the same values, you know, Christian values, serving others, witnessing to others. They definitely have the values that make it easier, much easier to work, you know, in medicine. Because I feel like in medicine, it matters so much who you work with, you know, if you're building each other up or you're letting each other down, you know, if you're helping each other get better or you're preventing from that, you know. And so I feel like I'm very blessed here to work with this team specifically. It's hard to start the clinic and also with the vision to serve community, you know, to do projects that are not profitable, where you actually have to put into your time and efforts and finances. I know that for our project, we look for donors, for those people who see the same thing, have the same vision, who also want to be helping those social groups, you know, whether it's veterans or military or underserved, and that are willing to give their finances to support those projects. As I mentioned before, I stayed in touch with some of the participants of the military surgery training. Actually, after our practical days, you know, after operating day, we had a debrief on how it went, what could be done better, what could be changed, and what other practical trainings we would need. And they had very good feedbacks because this training was practical. We operated on biomaterial, live biomaterial, and practiced the techniques that are necessary for trauma surgery, you know, the things that they face in the front lines. And so they gave great feedbacks on the quality of training and the techniques that we worked in. But also they gave ideas of other trainings, like to specifically how to handle head injuries, neck injuries, vascular control. And they kept telling me about that even now, months later. I had some of our participants send me photos and videos of them being on the field, shunting arteries to save a limb. And another video that I got recently was emergency thoracotomy to start heart, you know, for someone who had cardiac arrest because of multiple injuries and severe blood loss. Our colleague surgeon from the front lines, he sent me the actual video how they started the heart and that it was effective. They were able to stabilize the patient, you know, our defender, and send him to the next level to get the help he needs. Amazing story that I've heard in the stabilization station that I went to visit is that one of the soldiers was stuck on the field with severe injuries, with bleeding, and there was no way to evacuate him, and without evacuation he would die soon after because of the bleeding. And the commander of that medical unit, he said, okay, we'll load up the drones with units of blood and send it with drones, and we'll give IV needles and IV infusion set for someone to set up the IV and do the transfusion. So the only person who was with injured military was his co-soldier, and he opened up YouTube and looked the video how to set up an IV. He set up an IV and was doing blood transfusions up until the time they were able to evacuate him. And they evacuated him stable, and so on the stabilization station they were able to stabilize him better and send him, and he survived. And what I love about you know, that medical unit that I've visited is that they are willing to fight for those soldiers. You know, they are not willing to give up and say, oh, this is a hopeless situation. No, they figured out a way to save, or at least try to save those who were injured and who were stuck in the field. So, and that's what I've seen there. They fight till the end to try to help as much as they can. So what I've heard a lot is, you know, this war is different because the weapon that is being used is different, much more aggressive, much more unpredictable, you know, drones being used for attacks and bombing and all of that. So the injuries that we face and that we see are much more complex than those that have been faced before during other wars or even conflicts right now in other countries or communities. So our surgeons, they do face a different level of traumas, you know, and are trying to save people and injured with very complex injuries. Our clinic has many social projects from the beginning, actually. One of the visions of the clinic is to heal the wounds of the war. And so we have a program for our veterans and their families to provide screening and medical care, and as well as psychological care and physical therapy for veterans, but also their families. Because, you know, now we talk more about wives who stayed with kids at home by themselves, mothers and fathers who are waiting for their son to come back, and all the things that they face, you know, the stress of it, the sickness that it brings. And so our clinic had a vision to provide care for them as well, to show that there are people who want to help and who will, who are able to help, you know. And this is like a free certificate for both veterans and also for their wives, children, and parents. And so we provide ultrasounds, blood work, consultations of general practitioners and also specialists if needed, as well as physical therapy and psychotherapy or psychological support. What helps me is my faith, for sure, in God, you know, because this is the reality. You know, we can try to avoid the reality of pain and sufferings and sickness, but it's not avoidable. It's there, and as doctors, we have to be able to handle it in a healthy way. So my faith definitely helps. Prayers and reading God's word and remembering that He's the one who strengthened me to do the work He called me to do. A good teamwork, you know, being able to talk with other providers who care, we can discuss, we can vent, and it helps a lot as well. I think for me personally, working with patients in Ukraine is more personal. Especially I've noticed that not even just with patients, regular patient, but with military injured, it's much more emotional and personal when you realize that that's not the sickness that is causing this patient to suffer, but it's a different human being who is injuring, and also it's my people. To serve, for me, as a doctor, I feel like that's the skill that God gave me, you know, that's the passion that God gave me, and it's to do my best to provide the best care for those who are in need, who I am able to help, and to help them not just as a physician, but as a person, you know, to come to my patients with compassion, understanding, love, patience. And I feel like that's all through the Bible. That's how Christ served, and that's how He called us to serve as human, not as a doctor.